In the modern age of skepticism and medical consciousness, people tend to look for natural and organic alternatives to proper medical procedures. They seek treatments that seem safer and more appealing. This has led to a booming industry of fake medical treatments that is alarmingly underregulated. Among them is the IV spa treatment therapy. It is a treatment that claims to provide quick and instant wellness boosts by infusing the vitamins and hydration directly into the bloodstream. The appeal of this therapy lies in the promise of instant benefits such as better skin hydration and the feeling of rejuvenation, and in some cases, even the supposed anti-aging effects. However, the reality is more than just this. It's far more complex and dangerous. Despite the marketing assuring its safety and the calming spa environments, this industry has been linked to a multitude of complications and even death. While some experience minor inconveniences and issues, others face severe and life-threatening conditions. Consider the tragic case of this 37-year-old woman who sought out this treatment to revitalize her health. Instead of the promised benefits, she suffered a fatal reaction. Her story is not unique. It serves as a severe and stark reminder of the issues related with unregulated treatments and treatment facilities. The issues range from improper administration to lack of medical oversight, expose a dark side of this industry. The 37-year-old woman, referred here as Sarah, who believed in these alternative treatments. Despite having no particular medical records showing medical issues and was an otherwise healthy individual, she decided to explore these unconventional therapies. She had undergone a few of these IV treatments without any apparent issues, but tragically, one such session ended her life. In this fatal session, the IV drip being given to her contained a mixture of various substances. Among them was hydrogen peroxide and an organic solvent called DMSO, or dimethyl sulfoxide, and some saline solution. This blend of ingredients had lacked scientific backing for its supposed health benefits. DMSO had very limited usage during the 60s, but the use was largely abandoned due to the side effects, while hydrogen peroxide, a common antiseptic for treating minor wounds, has never had any history of being used medically as an intravenous treatment. The reason for this is because hydrogen peroxide immediately reacts with an enzyme present in blood, giving rise to oxygen gas that can clog up arteries and cause severe permanent damage. So why was it included in the IV mixture? According to the spa where Sarah received the treatment, the concoction was supposed to contain only a small amount of this substance. However, later investigations found that actual concentration was much higher than stated. So, what exactly happened? On that fateful day, Sarah walks into the spa expecting to get the rejuvenating effects she had enjoyed from her previous sessions. The spa workers hook her up to the IV. Sarah, given her past positive, albeit placebo-induced experiences, was relatively at ease and wasn't particularly nervous or anxious. However, shortly after the life serum began to pour into her veins, Sarah's condition took a drastic turn for the worse. She complained of severe nausea, which quickly led to vomiting. She eventually lost consciousness. The spa workers, alarmed by her sudden reaction, immediately called emergency services, hoping to get her the urgent medical help she desperately needed. The first responders arrived. They diagnosed Sarah with the pulseless electrical activity, or PEA. This condition occurs when the heart has electrical impulses, yet it fails to produce a palpable pulse, meaning her heart was still generating electrical signals but wasn't effectively pumping the blood. The situation was clearly dire. After 27 long minutes of continued resuscitation efforts, Sarah's spontaneous circulation finally returned. Sarah's calming spa treatment had now turned to an emergency crisis. She needed intubation and immediate transport to the intensive care unit for further medical care. In the intensive care unit, Sarah's condition was described as critical. She showed symptoms of multi-organ failure. Immediate treatment was given that included fluid therapy to help stabilize her condition, and then continuous renal replacement therapy to address possible renal failure brought on by the unknown mixture given to her intravenously. However, Her condition continued to deteriorate as the multi-organ failure continued to develop, leading to acute circulatory failure. She also had an overwhelming sulfur odor noticeably in her nausea and vomits, and since her symptoms aligned with it, led to an initial diagnosis of it being poisoning induced by DMSO overdose, as sulfuric smells are associated with this substance. However, it was later that this diagnosis was found to be incorrect. The misdiagnosis interrupted the appropriate treatment for her actual medical crisis and significantly impacted her chances of survival. Nonetheless, the medical team continued treatment and concluded more tests, including an ultrasound of the chest area that showed buildup of fluid in the chest cavities. Despite the intensive case, Sarah didn't make it, and tragically she passed away 24 hours after admission into the hospital. Investigations were soon carried out, and they found out during the questioning of the staff at the natural medicine clinic, it was revealed that a critical error had been made. One of the midwives, or medical staff, made an error in preparing and administering the treatments. Specifically, they administered an excessively high dose of hydrogen peroxide, a critical mistake that was not communicated to the emergency medical team during the patient's rescue, which hindered the ability to provide the most effective immediate treatment. Regarding the DMSO, its presence in both before death and post-mortem blood was below the toxic levels. Moreover, the metabolite of DMSO, dimethylsulfone, was confirmed, which according to literature is not a toxic substance. The focus on DMSO as a probable cause led to a delay in addressing the true underlying issue, which was the excessive hydrogen peroxide. After the investigations, it was determined that the severe lung and heart damage caused by hydrogen peroxide being administered through an IV caused formation of lethal air bubbles in the intricate and narrow blood vessels of the brain and heart, depriving these vital organs of the much-needed oxygen. The lack of oxygen in these critical areas caused the failure of essentially bodily functions, ultimately leading to the tragic and untimely death of Sarah. Further examinations proved the flaws in the clinic's protocol regarding the lack of proper training and oversight in the preparation of the treatments. The clinic staff's failure to follow the safe practices and accurately reporting the composition of the IV mixture significantly impacted the medical response and outcome. Based on the information that was gathered, it was clear that excessive hydrogen peroxide was the main reason for death. The midwife that admitted to that mistake agreed to a 1.5-year prison sentence and a 3-year ban from practicing as a midwife. The authorities concluded that the other spa staff were not at fault, as there had been no particular recorded issues with the therapy before this incident. In the end, it was concluded that the lack of accurate information about the substances given prevented the implementation of proper treatment that could have been aimed at the hydrogen peroxide administration. The patient's symptoms, including the distinctive odor, led to a mistaken diagnosis of DMSO overdose, which was not the actual cause of the symptoms. In addition, using experimental and unsafe treatments that don't align with traditional evidence-based medicine and natural and organic alternative treatments pose a huge risk to the lives of the patients. The use of unregistered chemicals to prepare cocktails, especially when prepared by staff that don't have the proper training for such tasks, like the midwife in this case, further jeopardizes the safety of those getting the treatments in such clinics. While this particular case occurred in Poland, similar cases occur all around the globe. In numerous places, terms like natural and organic are not regulated. They don't have a set definition for their usage, or in this case, a procedure, and appear safer and more appealing. Often these terms are used to market products or treatments as being scientifically validated or risk-free, while they may actually be rooted in pseudoscience. A similar case occurred in California, where a 24-year-old woman who was looking forward to losing some body fat with the treatment, it turned into a nightmare when the woman developed an antibiotic-resistant bacterial infection. Within just 24 hours of getting the treatment, the 24-year-old complained of feeling dizzy and feverish. According to her, each injection site was painful and had filled with pus. "Anything touching my skin was excruciating," she said. "My entire body felt like it was on fire." In 2021, the FDA warned that some medical spas and IV clinics were mixing products incorrectly and without proper sterilization, leading to serious patient illnesses and deaths. It's essential to address these gaps in regulations. As the industry for natural and alternative treatments grow, it's essential to implement stringent medical and safety standards to prevent such tragic incidents from reoccurring. Any product or procedure claiming health benefits should be subjected to rigorous scrutiny to ensure its safety. Adding more to the alternative trend, IV spa treatments aren't the only risky procedures. It is but one in many. Other such baseless practices include stuff like ingestion of colloidal silver, raw food diets, ozone therapy, and many more. These practices often lack scientific support and can pose serious health risks. There is, however, hope in the US. States such as Florida are actively pushing for stricter laws against health-related products, especially with bold claims. The proposed legislation in Florida includes measures such as requiring providers to screen patients for potential risks before administering any substances, notifying the patient's primary physician about the treatment, and having a written emergency response plan in place. Public safety is no joke and should never be taken as one. Safety and security in terms of medicine is especially a realm where strictness has to be enforced at all times to prevent the rise of bogus claiming treatments. What are some other standards that you think the health and beauty industry should be held up to? And do you think the prison sentence for the midwife was just? Share your opinions with us in the comments below. Before you go, make sure to like, share, and subscribe for more shocking stories. Thanks for watching. See you next time.